Part 2. The temporal region. This region is between the superior temporal line and superior border of the zygomatic arch. Now, this is the 6 layers of this region. Notice the names. The first skin is thinner and movable than upper region. The second, superficial fissure. The third, superficial temporal fissure. Which one? This one. Superficial temporal region fissure. It will continue to epicranial aponeurosis. The fourth, deep temporal fissure. So both of them are temporal fissure. Both of them are deep fissure, not superficial fissure. So the first one is superficial temporal fissure. The second one is deep temporal fissure. Then the fifth is the muscle, temporalis. It's a very thick muscle. The sixth is on the bone, pericranium. The character, this one is tightly connected with the temporal bone, not loosely connected. Now, during these 6 layers, they contain some vessels and there are some spaces. For example, between these 2 layers, there is a superficial temporal space. Between these 2 layers, there is a deep temporal space. So here, we can observe these 2 spaces. Now notice the first one, it will continue to infratemporal space. That space is not in temporal region, it's in the face. Okay. During this video, we will put importance on these 6 layers of the temporal region. Now let's go on. Now we will dissect the temporal region. This region is surrounded by the upper border of the zygomatic arch and the superior temporal line. This superior temporal line is a bony structure. The layers of this region. The first layer is skin. The second layer is superficial fissure. Then the third layer is temporal fissure. Notice this temporal fissure is divided into 2 parts. This part is superficial temporal fissure. It continues to epicranial aponeurosis. Temporal fissure, this one is a deep fissure, very thin and dense. It covers on the surface of temporalis, this muscle, temporalis. Superficial temporal fissure is not superficial fissure, it's deep fissure. Now next, we again see another temporal fissure. This is a deep temporal fissure. Now we will open this deep temporal fissure. So this deep fissure, here we can see here this is a 2 layers. Superficial temporal fissure and the deep temporal fissure, open to 8. If we open 8, can we see this muscle? Let's see. When we open it, we cannot see the muscle. We just see some adipose tissues and some small vessels. And we also can see another fissure. This fissure also temporal fissure. Here, these two layers, both of them are deep temporal fissure. Deep temporal fissure. So you can regard this temporal fissure into three layers. Here is superficial temporal fissure. Here are deep temporal fissure. Deep temporal fissure, again two layers. Remove it, we again see some loose connective tissues and vessels. And then deep to it is muscle, temporalis. Here, we should know a space. This space name is superficial temporal space. In this temporal region, we will look for two spaces. One is this one, superficial temporal space. The other one is deep temporal space. So what is superficial temporal space? It's between deep temporal fissure and temporalis. And this blade from this space downward, this one is zygomatic arch. Deep to the zygomatic arch, this blade go to lower. The lower, there is another space is infratemporal space. Infratemporal space doesn't belong to temporal region. It belongs to face, lower. So which space is continuous to infratemporal space? Is this one, superficial temporal space. So this space is very loose. We can separate it. Then we can see this temporalis muscle. Look at this fissure, it's very dense. Then we will cut open this temporalis along this region, inferior temporal line. Here, let's know another space is deep temporal space. Deep temporal space is between the temporalis and pericranium. This one. So these two spaces just to the boundary. Boundary is temporalis. Superficial is superficial temporal space. Deep to it is deep temporal space. Here, we will look at this pericranium. Pericranium is very thin. Now we will open it. It's tightly connected to the bone. It's difficult to dissect. It's not similar to the plateau region. This is the temporal bone, so it's difficult to dissect it, separate it. This is a summary of these two regions. The first region, frontal parietal occipital region. The first layer, skin. The second layer, superficial fissure. The third layer, epicranial aponeurosis. These three layers together is scalp. The fourth layer is subaponeurotic loose connective tissue or subaponeurotic space. The fifth tissue, this one, is the pericranium. 5 layers. Here, Let's look at this epicranial aponeurosis. This is a tendon. Anteriorly, it continues to this muscle belly, frontalis. Posteriorly, it connects to the occipitalis. These three together, two belly, one aponeurosis together is one muscle, occipital frontalis. This is the layer of temporal region. First, skin. Second, superficial fissure. The third, superficial temporal fissure, continues to epicranial aponeurosis. The fourth, deep temporal fissure, two layers. The fifth, temporalis. Between them, this space is superficial temporal space. Temporalis. Deep to it is deep temporal space. The last layer, sixth layer, is pericranium. Compare the soft tissue layers of the temporal region and the parietal region. Then the vessels and nerves of the buttocks. The first group is anterior group, supraorbital artery, supraorbital nerve, this one. Then supraorbital vein. Medial to them, supratrochlear artery, supratrochlear vein, supratrochlear nerve. These two nerves are from trigeminal nerve. Then lateral group, in front of ear, superficial temporal artery. Two branches, frontal branch and parietal branch, go to the buttocks, supply the scalp and superficial fissure. Then the nerve is auriculotemporal nerve from the trigeminal nerve. This is a sensory branch. This nerve is temporal branch from facial nerve. This is a motor branch. Then behind the ear, this nerve is lesser occipital nerve from cervical plexus. Supply the skin here. Sensory nerve. Then this vein and artery, they are posterior auricular artery and vein. This one is vein. Here is posterior auricular lymph node. Here, this one is a posterior group, occipital lymph nodes. Collect the lymph from occipital region. Then occipital artery, go to buttocks. Supply the scalp of occipital region. Greater occipital nerve from the posterior branch of C2, also sensory branches. Notice these branches, they are joined together. They are from the superficial temporal artery, two sides. Very rich, admonomous together. This branch is from the supraorbital artery, also joined together. So the scalp is very rich of blood supply. This is branches from the occipital artery.